Namaste, everyone. Welcome to the Lotus Opening Program, which is focused on, this one is focused on pregnancy challenges and relief. So, you will learn about breathwork techniques that will help you overcome challenges connected with pregnancy and bring you very good relief. As you are aware, uh, a condition called vasoconstriction often happens whenever we are under any kind of stress, tension, depression, etc., etc., etc. If the mind is affected in a negative way, the body also responds in a negative way. There is a very deep connection between mind and body. So very often, because when a mother is carrying a baby, etc., there is a lot of pressure on her, a lot of challenges for her, and she faces many difficulties in the process of carrying the baby inside her, both internal and external, due to which a condition called vasoconstriction can happen. Whenever vasoconstriction happens, it affects the baby and the mother in a very negative way. Dr. Shashi Jindal is here with us, and she will explain the concept of vasoconstriction and vasodilation, especially for pregnant women and mothers to be. And if you have any questions, you can address them to Dr. Shashi Jindal. Welcome, Dr. Shashi Jindal. In the meantime, please turn on your audios and videos so that we are able to communicate more effectively. Kakoli ji, Manish ji, Chandni ji, please turn on your videos and audio so we can communicate better. Ji, Shashi ji, namaste. Please start.
Namaste ji, namaste. So good afternoon everyone and Shubh Dopair and welcome you all, and I am thankful to Raj Yogi Rajesh Kanoi for letting me join this webinar and making my presence so that it can get benefited to patients can get benefited, and they can know that what is the scientific aspect of the breathing techniques. So first I will tell you that what happens in normal pregnancy. So normal pregnancy itself is a vasodilatory phenomena, and this vasodilatation takes place in normal pregnancy because of the secretion of hormones called estrogen and progesterone. So they both have the dilatation effect on the vessels, and it keeps the placenta uh, get proper blood flow because the vessels get dilated, and it compensates the uh, increased demand of the fetus, and blood volume is increased in pregnancy. So with the dilatation of the vessels, this demand is increased, and it helps with the fetus in growing properly. Now, to know that what happens if this mechanism is hampered, how can this get hampered? Either due to some pregnancy complications which can cause increase in blood pressure, and which generally happens in elderly patients, and those who have bad obstetric history and all that. So in those patients, generally the stress takes place automatically, and as we all know that whenever there is a any stressful situation in mind, the hormone called catecholamines, which are steroids in nature, gets secreted, and they stimulate the sympathetic nervous system, and which is causing vasoconstriction. As soon as the vasoconstriction takes place, the vessels get constricted, and it first of all decreases the blood supply to the placenta, and it starts the blood volume which is increased, it starts going through the narrow vessels, and it causes increase in blood pressure. When the blood pressure increases, it can cause sometimes convulsions, sometimes the decreased blood flow can cause the restriction in the growth of the fetus, which is a very, very significant event, as pregnancy itself causes some kind of stress on patient's mind, and the vasodilatory effect gets neutralized by the hormone called catecholamine secreted in pregnancy due to stress. So that mechanism which was helpful you in automatic way because of the vasodilatation now is compromised. So in first trimester of pregnancy, these all things are very, very important. And that is the time when we don't want to take medicines. We all doctors also say, except some folic acid and symptomatic medicines, we don't want to give you extra medicine load. So if according to the Raj Yogi's breathing techniques, you can have that vasodilatation effect naturally in pregnancy only just by learning the breathing techniques. Nothing can be better than this. So my opinion is that the first trimester of pregnancy, where the increased demand of the fetus is met by the vasodilatory effect of pregnancy, is helped by the breathing techniques, which we are going to learn from Raj Yogi, Mr. Kanoi, from this Lotus Opening Program. And I strongly support this because, as I told you, this vasodilatation in pregnancy is very, very important. Otherwise, the sympathetic stimulation gets overpowered, and then the constriction can cause preeclampsia, IUGR, premature delivery, and all these complications can happen because of the decreased blood supply. So the vasodilatory effect, which can happen naturally with breathing techniques, is strongly recommended. Now the other benefits you can hear from Raj Yogi, Mr. Kanoi. Over to you.
Thank you. Thank you, Dr. Shashi Dindal. As you know, she's a very well-known gynecologist in Kolkata. And I think Rashmiji has a question for Dr. Shashi Dindal. Please go ahead. Rashmiji, go ahead, ask.
Good afternoon, ma'am.
Yes.
I actually, I myself am 53, so I'm not
Okay.
asking this question for myself. But my daughter had delivered last 6 months. तो उसका क्या हो गया था प्रॉब्लम कि लास्ट में एमनियोटिक फ्लूइड कम हो गया.
हाँ
तो
जी.
कैन आई नो द रीजन कि ऐसे एमनियोटिक फ्लूइड क्यों कम हो गया.
हाँ, एमनियोटिक,
एंड
जैसा कि
लाइक
मैंने अभी,
उसका, हाँ, उसने
एमनियोटिक
उसने
फ्लूइड
बोला
कम
मेरे कुछ
होता है.
लीकिंग वगैरह नहीं होता था.
एमनियोटिक
Pardon?
फ्लूइड होता कम है, अगेन बिकॉज ऑफ द पैरासिम्पेथेटिक स्टिमुलेशन एंड वाजोकंस्ट्रिक्शन, क्योंकि उसमें ब्लड सप्लाई कम हो जाता है, एंड जो आर्टरीज से जो नेचुरली ब्लड फ्लो इंक्रीज होना चाहिए, जो न्यूट्रिशन उसको मिलना चाहिए बेबी को, एंड जिससे जो एमनियोटिक फ्लूइड जिसमें बेबी रहता है उसमें जो सिक्रीशंस होते हैं ब्लड वेसल से, वो कम हो जाते हैं. So indirectly, it is again that it goes back to the vasoconstriction in pregnancy. So to compensate that, we again need vasodilatation. And for vasodilatation, we can do breathing techniques, which automatically relaxes the mind, and oxygen supply also increases. When you are doing breathing techniques, then definitely the breathing increases, the oxygen also inhalation increase hoga hi na, if you are taking proper breathing
हाँ,
by abdominal breathing, which he will explain to all of us. So that definitely increases oxygen flow also inside, and oxygen perfusion से blood perfusion होता है in the all the cells uh, get the benefit of oxygen, and it gets the blood perfusion well, and that indirectly is proportional to the increase in amniotic fluid. So
okay.
I hope you understood the mechanism, that
Yeah, yeah,
how
yeah, ma'am.
breathing can uh,
Help out.
help you in increasing the amniotic fluid also.
Yes, ma'am. Thank you.
I have a
Hmm.
follow-up question to Rashmiji's question. She said her daughter faced reduction in amniotic fluid, etc. Now, there must be certain complications that have affected her because of whatever difficulty she went through during pregnancy. Is there need for her to come back or increase vasodilation in her system post pregnancy also?
In case the decreased amniotic fluid volume has affected the pregnancy in a way that the growth restricted and the delivery had to happen early, I mean, there was premature delivery and all these complications, happen during the pregnancy, then definitely the baby's outcome will not be that great. And in postpartum period, because of that poor outcome of the pregnancy, patient naturally will be stressed more. She will not be able to enjoy the baby as much as she could do in a healthy pregnancy. So that time it is even more required for her to have the vasodilatation effect by having deep breathing exercises and all that. So indirectly
Okay.
the postpartum period is also affected by the events which she undergoes during antenatal time.
One more
Okay.
question. Does
Thank
it
you.
also affect the milk flow of the mother if she is vasoconstricted for whatever reason?
Milk flow is actually now, first you must know that how milk flow happens in pregnancy. सो प्रेगनेंसी में एक प्रोलैक्टिन हार्मोन होता है, वो भी नेचुरली सिक्रीट होता है, इंक्रीज हो जाता है. और लास्ट के ट्राइमेस्टर में, लास्ट थर्ड ट्राइमेस्टर में दैट प्रोलैक्टिन गोज वेरी हाई. एंड प्रोलैक्टिन इज ऑल्सो directly proportional to the stress. Like stress also increases prolactin. So if the prolactin secretion gets disturbed in this last trimester, then because that only will help in milk flow, lactation will be directly affected by the uh, patient's mind and situation through which she is passing at that time. So I think the milk flow also should get affected by that, because it is directly proportional to the stress hormone, which is prolactin. The secretion is affected by the prolactin, which is a stress hormone. So I feel that the not the vasodilatation, but the uh, milk flow definitely will, as we have seen in many patients who are having too much stress in the, like ambience is not good, household conditions are not good, they can't breastfeed the baby much because they are going through some mental stress. So their milk flow automatically gets decreased. So I think the milk flow is also
Negatively
affected by the
affected.
vasodilatation.
Okay,
Thank
very good. Yes. So Dr. Shashi Jindal is explaining about vasoconstriction in pregnancy and the dangers that can happen when vasoconstriction takes hold. Uh, of course, stress and depression are one of the effects or some of the effects, but there are other physical effects in the body as well, which is what she's talking about. If anyone has any questions for Dr. Shashi Jindal, please go ahead. And as a gynecologist, she can take these questions and answer you very well. So take advantage of her presence here, please. Yeah, if you turn on your videos and audios, that'll help.
Yes, go ahead. It will be my pleasure to solve all your queries. Thank you.
Magdalena ji, Kakuli ji, do you have anything to say? Any question, Kakuli ji? I don't think you are also carrying a baby, I guess, but I don't know. I'm just guessing.
Actually, I had tried to share it with many of my mothers who will be conceiving in future, and mother-in-laws who will be having the daughter-in-laws getting pregnant. But somehow I feel the people didn't understand this. So only pregnant patients are thinking that it will be benefited to, they will be benefited. But I think it is helpful in postpartum period as well. And the mother-in-laws also should go ahead, because they can
And
also help. They
really
can also.
speaking, what I am thinking, कि, uh, people are thinking कि how breathing can affect this. That is what
Sorry.
the thing. So how breathing can affect the pregnancy.
हाँ,
People
तो
are not
ब्रीदिंग
aware
से ही
कि
तो,
how breathing
नहीं,
can
मैं यही तो बताया आपको कि वेजो डायलिटेशन मतलब कि वेसल्स का डायलिटेशन, और ब्रीदिंग में क्या
uh,
होता है, दैट इज ए रिलैक्सेशन टेक्निक. सो जब व्हेन आप डीप ब्रीदिंग करते हो तो वेसल्स गेट ऑटोमेटिकली डायलेटेड. जो इफेक्ट ईस्ट्रोजन प्रोजेस्टेरोन से हो रहा था, जिसकी वजह से वेसल्स डायलेट हो रही थी, वो यदि आप लंबी सांस लेते हो तो आपका नेचुरली जो पैरासिम्पैथेटिक स्टिमुलेशन है वो ज़्यादा होता है एंड वेगस नर्व स्टिमुलेट होती है, तो वो अपने आप डायलेट होती है वेसल्स, तो फिर वो ज़्यादा ब्लड
मैम,
जाएगा प्लेसेंटा के थ्रू, बेबी
हाँ
को
वो
ज़्यादा
चीज
ब्लड
है, बट
मिलेगा।
मैं और आप अवेयर है ना, यंग मदर्स आर नॉट अवेयर ऑफ दिस कि हाउ ब्रीदिंग विल अफेक्ट।
So
उन
that
लोग
is
को
why
ये नहीं समझ
that is
आता।
why
या
Mr. Yogi has arranged this webinar, because he wants to benefit. He wants to let these ladies know that what is the.
या
मैं
दैट्स रियली
डॉक्टर
वेरी
होते
गुड और
हुए भी, मेडिकल डॉक्टर
होपफुल
होते
था।
हुए भी इसलिए इस बात से सहमत हूँ क्योंकि मैंने बहुत पेशेंट्स को फर्स्ट ट्राइमेस्टर में ये डीप ब्रीदिंग टेक्निक सिखाई है, और बहुत सारे पेशेंट्स का जिनका प्रीवियस प्रेगनेंसी में हाइपरटेंशन था वो नेक्स्ट प्रेगनेंसी में नहीं हुआ, बिकॉज उन्होंने शुरू से ही डीप ब्रीदिंग टेक्निक्स को अच्छे से यूटिलाइज किया एंड बहुत अच्छे से करना शुरू किया। तो अपनी ड्यूटी है कि as you are a mother-in-law or mother for a would-be mother, so you should also spread the word and tell other
या
mother-in-laws to guide their daughter-in-laws.
मैम, एक और क्वेश्चन था, माय
हाँ बोलिए।
पर्सनल। वो खैर आई कांट हेल्प इट अब तो, बिकॉज क्योंकि मेरे ड्यूरिंग माय डिलीवरी फर्स्ट बेबी, तो उस समय डॉक्टर ने बोल दिया वो मुंह पूरा नहीं खुला, इसलिए हम लोग को फोर्स डिलीवरी करवाना, फोर्स डिलीवरी होते हैं ना, वो करवाना पड़ा। तो उसमें भी क्या ब्रीदिंग का फर्क पड़ता है?
क्या आपने क्या पूछा? कम अगेन, मेरे को एक बार फिर से क्वेश्चन बताइए आपका।
क्वेश्चन ये है कि मेरा डिलीवरी के टाइम पूरा मुंह नहीं खुला था, वो यूट्रस
डीएनसी
का
के
मुंह
टाइम?
जितना खुला। पर
डिलीवरी के टाइम कि डीएनसी के टाइम?
नहीं, डिलीवरी के टाइम।
डिलीवरी के टाइम मुंह खुला नहीं था। हाँ,
तो
तो
पूरा नहीं
इसलिए
खुला था।
उन्होंने सीजर कर दिया।
Uh,
हाँ,
If I may
तो
interject, I think
उसमें
does she mean the vaginal opening did not open enough for the
या
नहीं
baby?
नहीं,
या दैट इज राइट।
she want to know that the cervix did not dilate.
Cervix did not dilate, yes.
हाँ, so cervix में I think the now here comes the combination of breathing techniques and the medical help. खाली ब्रीदिंग करने
ओके।
से सर्विक्स का मुंह नहीं खुल सकता, उसमें हमको
हाँ
वेजो डायलिटेशन के लिए जो सर्विक्स की जो मस्कुलेचर है उसको डायलेट
हाँ।
करने के लिए हमको डेफिनेटली कुछ मेडिसिन देनी पड़ेगी, खाली ब्रीदिंग टेक्निक, बट दैट विल बी एडेड इफ यू आर डूइंग ब्रीदिंग ऑल्सो विथ इट, मतलब इट
ओके,
विल बी एनहांस्ड, ये इफेक्ट और ज्यादा
गुड।
अच्छा हो जाएगा जो हम मेडिसिन देते हैं उसको रिलैक्स करने के लिए। एक्चुअली क्या होता है, मुंह नहीं खुलता है तो इसका मतलब कि उसको सर्विक्स को थोड़ा रिलैक्स किया जाए ताकि वो स्ट्रेच
हाँ
हो, है ना, और फिर वो और
हाँ।
खुले। तो उसको स्ट्रेच करने के लिए फिर सेम चीज वही है कि उसकी मतलब ऑक्सीजन उसमें ज्यादा जाए,
उसको
जैसे कि
दाना
ब्लड
दाना अपने
सर्कुलेशन
ज्यादा
ज्यादा
मिले
हो,
तो अपने।
तो वो
जी,
सब कुछ
राइट
ले
राइट
दे के अल्टीमेटली वहीं आ जाता है कि जितना
ब्रीदिंग पे ही
रिलैक्स
आ
हो
जाता
सके पेशेंट उतना अच्छा है। तो रिलैक्सेशन के लिए ब्रीदिंग इज इम्पोर्टेंट। सो आपको
है।
ये समझना चाहिए कि हर चीज में थोड़ा फायदा तो
ब्रीदिंग
इससे
जरूरी है।
होगा ही, क्योंकि ब्रीदिंग ऑलवेज रिलैक्सेस द मसल्स, इट रिलैक्सेस द वेसल्स, it increases the blood flow, it increases the oxygen demand, oh sorry, oxygen supply, so indirectly it is related.
थैंक यू मैम।
Excellent. Very good.
Anybody else wants to know anything? Rashmi ji सबसे ज्यादा interested है, और कोई interested नहीं है?
Yeah, please turn
How
on
many
your
people
videos
are
and
there with us?
talk to Dr. Shashi Jindal. So basically, I'll recap what Dr. Shashi said in Hindi. Basically, what she's saying is that whenever there is any kind of stress reaction in the body, whether it's mother who's about to deliver or even in the postpartum, that means after delivery, it affects the well-being of the mother. During the delivery period, if there is stress, tension in the body, then sometimes the cervix does not open enough. So, therefore, one has to go for a cesarean delivery. Basically, in my layman's terms, I would explain it this way. But if there is a deeper level of relaxation, and sometimes breathing also, while breathing helps, sometimes a little additional medical involvement is also required. So they might give certain medicines to help the cervix relax a little more. Is that right, Dr. Jindal?
यस दिस इज राइट. और वो मुंह खोलने के लिए हम लोग रिलैक्सेशन का मेडिसिन तो देते ही हैं, पर उस टाइम पे यदि पेशेंट करेज
Relaxed.
रखे और साथ में अपने माइंड को रिलैक्स रखे बाय डूइंग दीज ब्रीथिंग टेक्निक्स, आई थिंक इट विल इंक्रीज द इफेक्ट ऑफ यू नो our medicines also. This is what I think.
Great, very good. Yes. So I think that answers your question, Rashmi ji. I hope you have more clarity on the topic. Yeah. What
Yeah,
about the
I
host?
have
Please
clarity.
turn on your video so that we can see who is here, and then of course there is better communication. Uh, if anyone has anything to say or ask Dr. Shashirindal, please go ahead. Or I'll explain a little more about vasodilation, vasoconstriction, etc. from the breath point of view, which is my
Point of view, yeah.
breath point of view.
Now
So,
we have told them about the consequences of vasoconstriction if it takes more than what is required,
hmm,
because little bit of constriction is also required in pregnancy. It's not that only vasodilatation is the combination.
yes.
So if it is happening more because of stress and all, then the breathing helps. So we have told them about the intrauterine growth retardation, placental insufficiency, IUGR, and that preeclampsia, premature separation of the placenta. All these can happen if the proper relaxation techniques are not followed and patient is too much stress. So now you can explain them how you do those breathing techniques. Little
Yeah.
bit introduction to that will
Yes,
be
I'll do
helpful.
that. In the meantime, you use certain medical terms like IUGR, preeclampsia, and so on. So, can you explain these to the lay person a little more so that their understanding is better?
हाँ, प्री एक्लेम्शिया में एक्चुअली इंक्रीज ब्लड प्रेशर की वजह से ये कंडीशन होती है जिसमें कि ब्लड सप्लाई कम हो जाती है प्लेसेंटा को और वेसल्स कंस्ट्रिक्ट हो जाती है, तो ब्लड प्रेशर बढ़ने लगता है और किडनीज को भी ब्लड सप्लाई कम हो जाती है, तो वो जो किडनी की एक्सक्रीशन मैकेनिज्म है वो डिस्टर्ब हो जाती है और एल्ब्यूमिन सिक्रीट होने लगता है. तो ये दोनों तीनों चीज़ों को मिला के प्री एक्लेम्शिया बोलते हैं, जिसमें ब्लीडिंग, ब्लड प्रेशर इंक्रीज हो जाता है, किडनी से प्रोटीन एक्सक्रीट होने लगता है और कभी कभी इतना ज़्यादा कॉन्स्ट्रिक्शन हो जाता है और ब्लड प्रेशर इतना बढ़ जाता है कि पेशेंट को कन्वर्जेंस माने तान वगैरह आने लगती है. तो इस कंडीशन को प्री एक्लेम्शिया बोलते हैं, विच इज़ वेरी कॉमन इन प्रेगनेंसी. एंड ये जनरली जो प्लेसेंटा जो जो कि मेन थिंग है जो सप्लाई करती है मदर के मतलब फीटस को, तो उसमें जो ब्लड वेसल्स होती हैं उनके कंस्ट्रिक्शन से होती है. और एक यूट्राइन आर्टरीज होती हैं जो कि फीटल सर्कुलेशन में कनेक्टेड रहती हैं, तो उन यूट्रस की आर्टरीज में और प्लेसेंटा की आर्टरीज में जब कंस्ट्रिक्शन हो जाता है तब ब्लड प्रेशर बढ़ता है और उस कंडीशन को प्रीएक्लेम्शिया बोलते हैं. और उसी कंस्ट्रिक्शन की वजह से बिकॉज ब्लड वॉल्यूम जितना बेबी को ब्लड चाहिए उतना नहीं मिल रहा, तो उसकी ग्रोथ कम होने लगती है और वो जो अंदर का एनवायरनमेंट है वो अनफेवरेबल होने लगता है बेबी के लिए. पानी जो कि इन्होंने पूछा था रश्मि जी ने कि एमनियोटिक फ्लूइड कम हो गया था, तो वो सूखने लगता है और उस कंडीशन को फिर इंट्रा यूट्राइन ग्रोथ रिटार्डेशन बोलते हैं. मतलब कि यूट्रस के अंदर का एनवायरनमेंट इज नॉट सुटेबल फॉर द बेबी, तो ऐसी कंडीशन में फिर बेबी को बाहर निकालना पड़ता है. सो उसको बोलते हैं IUGR. और
Thank you very much.
प्लेसेंटल सेपरेशन में भी ये होता है कि बिकॉज इंक्रीज ब्लड प्रेशर हो जाता है, तो जो प्लेसेंटा यूट्रस की वॉल से अटैच होता है वो बिकॉज ऑफ द टू मच प्रेशर इन द वेसल्स वो अपनी जगह से थोड़ा सा सेपरेट हो जाता है. तो जब वो अपनी जगह से सेपरेट हो जाता है तो उसके पीछे से ब्लीडिंग चालू हो जाती है. तो फिर वो जब ब्लड आने लगता है तो फिर भी हम लोग ज़्यादा फिर वेट नहीं कर सकते, तो फिर ऐसी कंडीशन में फिर हम लोग को सिजेरियन करना पड़ता है. तो उस कंडीशन को अब्रप्शियो प्लेसेंटा बोलते हैं. एंड दीज आर द मोस्ट कॉमन इफेक्ट्स ऑफ सीवियर वासोकंस्ट्रिक्शन.
Hmm. Very nice. I hope you've got a fair idea about some of the challenges that happen when vasoconstriction happens in the body usually due to stress, tension, depression, and so on and so forth. Any follow-up question for Dr. Shashi Jinder? No? So let me explain from the breath point of view or from the breath coach point of view. As a breath watcher, my journey has shown me how simple breath work techniques can help overcome many difficulties connected with stress, depression, etc., etc. In There are two terms that are used, in fact, which Dr. Shashindra also used, uh, parasympathetic nervous system and the sympathetic nervous system. They are both part of the autonomic nervous system. So the functions of the body are done automatically through
Balance.
the, sorry.
I'm sorry, I interrupted. Balance of these two systems.
Yeah. So the autonomic nervous system contains both these systems, parasympathetic and the sympathetic nervous system. But if one is in operation, the other is not in operation. So it's either this or that. If the parasympathetic nervous system is active, that means the sympathetic nervous system is not active. And if the sympathetic nervous system is active, that means the parasympathetic nervous system is not active. Now, what is the problem and what is the result of either of these activations? When the sympathetic nervous system is active, that means the body is in a fight or flight mode. That means there is some risk, danger, threat to the person. When there is any risk or threat, etc., what can we do? Supposing I'm in danger, I can either run away from that danger or I can fight that danger. So if we are in the sympathetic nervous system, it helps with that. But the problem with the sympathetic nervous system is that it interferes with our wellness. The systems of the body, in a sense, they begin to clamp up. They begin to redirect the resources of the body to those parts of the body that are needed to either fight or run away. In the parasympathetic nervous system, the body is relaxed, the body is able to heal itself, the body is able to repair itself, and the body is able to function at its best level. So therefore, the more we are in the parasympathetic nervous system, the more the body is in a good condition to look after itself, to be healthy, and so on. If the body is uh, very often in the sympathetic nervous system, if it is in the sympathetic nervous system for half an hour, 1 hour, 2 hours, that's not the issue. The problem is when somebody becomes habituated to being in the sympathetic nervous system. The more time we spend in the sympathetic nervous system, the more the body is unable to heal itself. Then the other thing that happens is a habit begins to develop in the system. One of the habits that we notice is that whenever we notice there is stress, etc., we feel a tightness in the belly. Have you noticed this? Please answer my question. Whenever you are stressed, whenever you feel tensed, whenever you feel angry, you notice a constriction, a tightness in the belly. Does that happen to you?
Yes, sir.
Yes. Yeah, please answer me
Yeah.
the others
We
as well.
face an overwhelming situation.
Sorry?
We face an overwhelming situation. वो
Yes.
मतलब एकदम टाइट हो जाए and आपको अच्छा नहीं लगता कुछ.
Yes. The body,
This happens with the overstimulation of the sympathetic system.
exactly.
So we have to use the term overstimulation when we are talking about the sympathetic stimulation, because normal stimulation will not cause this.
So overstimulation of the sympathetic nervous system causes vasoconstriction. Now, whenever vasoconstriction happens, you will notice, for example, you are stressed, sometimes you find your breathing becomes difficult. You struggle to breathe. You feel short of breath. Then sometimes some people have other conditions, like there may be fainting or, like numerous other kinds of conditions that can happen when too much vasoconstriction begins to take hold. Is that right, Dr. Jinder?
Scientifically ये होता है उस टाइम पे the blood supply to the brain decreases suddenly. So the brain gets decreased oxygen and hypoxia happens. मतलब ऑक्सीजन की कमी से जो कंडीशन होती है उसको हाइपोक्सिया बोलते हैं।
हम्म,
और हाइपोक्सिया में बॉडी को और ज्यादा ऑक्सीजन चाहिए किसी भी तरीके से। तो दैट्स वेयर योर ब्रीदिंग टेक्निक कम्स इनटू पिक्चर, बिकॉज टू कॉम्पेंसेट दैट हाइपोक्सिया, if you are taking proper breath rather than like taking short breaths, if you are taking deep breaths, then the oxygen requirement is compensated.
excellent. Yes. So the idea, especially for a mother or mother to be, is to be relaxed. Because when she's relaxed and when she's in the parasympathetic nervous system, the systems in her body will flow better. This body is 70% water. Now, the water is in different shapes. Of course, it's not just water, but in different combinations of water. Like blood is also a kind of water. Like the lymphatic system is mostly a kind of water. Of course, there are nutrients and other things included there. But basically, 70% of this water that is the body, these systems need to flow. Digestion is better when the systems are flowing well. Blood flows or the blood circulation is better when the system is relaxed. Similarly, the lymphatic system is functioning better, which means our immunity is impacted directly and indirectly both when the systems are flowing well. And this affects our reproductive system, our endocrine system, I mean, basically every system in the body is affected when it is in a state of parasympathetic nervous system. Under parasympathetic nervous system, it can heal itself much better. If for any reason, due to stress, any kind of stress, habitual stress, etc., the body is in a more sympathetic nervous system or it is under vasoconstriction, all kinds of difficulties begin to take over. Blood pressure is one of the things that Dr. Shashi Jindal mentioned a little while ago. And of course, there are numerous other things. Even conditions like sugar or diabetes and so on, they're all directly connected with vasoconstriction and vasodilation. A very interesting thing that you can research on your own is almost all negative conditions of human life, almost all, I'm not saying absolutely all, are connected with vasoconstriction. Almost all positive things in life are connected with vasodilation. Almost all, again, not absolutely all. So, for example, if you are in a meditative state, Rashmiji was speaking earlier about some spiritual goals, etc. So one of the things that we use for our spiritual growth is meditation. Whenever we are in a meditative state, the body slowly comes into a vasodilated condition automatically. You will notice your breathing becomes smoother, lighter, easier, and so on because the body is in a more vasodilated state. Similarly, any kind of disease, any kind of condition, stress, etc., depression, vasoconstriction takes hold. Anybody who's facing any kind of depression, etc., you will find that there is some, or maybe even a very strong amount of vasoconstriction happening in the body. Problem is usually people are not able to deal with the vasoconstriction directly. They go for medication. There are I did an interesting search online. I looked for a term wonder drugs. So because some medicines are called like wonders, because of the effect that they have on our systems. I found four drugs listed. One was insulin, one was aspirin, one was morphine, and the fourth was, I forget. It'll come back to me later.
Sorbit
Sorry?
Sorbitrate, I think.
No, not sorbitrate. If you like,
Nitro.
I'll just tell you one. Just give me a moment. So the four, I've shared that in one of my pieces with you, Dr. Jindal. You remember I sent you some screenshots?
Yeah.
It has,
That's there.
it's mentioned there, yes. I'll just take it out. So the important thing is that when all these four wonder drugs have they induce some level of vasodilation in the body. Very interesting. All these four wonder drugs, they induce a certain level of vasodilation in the system.
Come
So there,
again. What were the names of those drugs?
Yes, I'm just trying to find that. I've listed it somewhere. I haven't shared it too widely.
Morphine, I understand morphine can cause relaxation.
Vasodilation, yes. One second, just give me a moment.
Nitric oxide,
No,
uh,
nitric oxide is it's not a drug. It's a thing
it's
that
a gas.
it's
So
something
that
that the body
also
produces anyway.
the medicines which produce nitric oxide
Mhm.
must be causing
Exactly.
vasodilation.
Yes. Yes. I've when you want something, you can't find it.
Okay, never mind. We can. Uh,
One second, I'll just do a new search. Wonder drugs. I think that'll be easier. Wonder drugs. Yeah. So penicillin. Yeah, that's the one I forgot. Penicillin. Penicillin.
Penicillin.
Penicillin, morphine, aspirin, and what is the other one? I said it earlier. Anyway, so all these four major wonder drugs, they all induce some level of vasodilation in our system. So therefore, what this indicates is anything good to happen for the body to be in a good state, a certain amount of vasodilation is almost a necessity. There are times when vasoconstriction is important. For example, if there is an extreme loss of blood or when the blood pressure is very low, that's when vasoconstriction can help. But otherwise, usually vasodilation or the vasodilated state is the ideal state for the body so that it's able to function at its optimum, at its best. Do this research and you'll understand. Understand the connection between vasoconstriction and illnesses, diseases, and so on. Understand the connection between vasodilation and the good things, calmness, joyfulness, meditativeness, being relaxed. They're all connected with some states of vasodilation. Are we clear on this?
Of course.
Lotus opening. What does lotus opening do? Lotus opening equips participants with breathwork techniques that help you get into a vasodilated state without using any kind of chemicals, substances, medicines, etc. Any of those. Simply with the power of your breath and of course the resources within your body. You get into a vasodilated state. So now, when you have power, if you understand how negative vasoconstriction can be and how beneficial vasodilation can be, and if you're able to induce vasodilation in your system just with the power of your breath and the power of your mind, can you imagine how much control you can get over your own system simply with these things? Any questions so far for Dr. Jindal or for me? Anybody? It's good to have some interaction. It's good to have an exchange. So if you have something, please go ahead. Any
I
questions?
don't have a question, but I have a comment to make that you are conducting your thing very well. Like you are
Okay.
conveying the message beautifully. So this
Thank you,
is
Dr.
my comment.
Jindal. Yeah, coming from you, that makes that's a big thing, Dr. Jindal.
So later on, I can guide my patients to, get the benefit of this program.
Absolutely.
And I think as there are no medical questions, with your due permission, can I take your leave?
I think we'll have you for a few minutes more because sometimes the
Or
questions take a little while
okay.
to kind of become clear. I think Magdalena has a question. Go ahead, Magdalena.
Yes,
Okay.
I'm sorry. I'm sorry I missed the beginning.
Mm, no worries.
So, I only wanted to ask, like, how would you describe the vasodilation? I'm sure you already described it, but is it like happening? Is it only a cardiovascular thing, or it is including like other system? I understand it's like some tension in the
Blood
cell
vessel.
membrane or in the veins?
The
I don't know.
muscular walls of all the systems, basically. Now, if you look at it from the medical point of view, they will say that it's mainly on the cardiovascular system. But that's not all it is. For example, if there is vasoconstriction, your breathing becomes difficult. Now, if your breathing is becoming difficult and it's only a cardiovascular thing, why should breathing show difficulty with that? So there is obviously a very deep connection between vasoconstriction and not just the cardiovascular system, but even the respiratory system, digestive system, reproductive system, endocrine system, all the systems are affected by it. And this is based on
Uh,
personal observation. Yeah, go on.
Can I make a scientific comment about this?
Yes, please.
So, actually, what happens with the blood cardiovascular involvement and the dilatation of the vessels, like supposing respiration, as you said, that how that helps. So, the oxygen requirement, which is increased, is compensated and met by the blood
Better
vessels
breathing.
dilatation, and indirectly it increases the perfusion and also affects the respiratory system. So all the systems, because the blood supply is increased, the oxygen perfusion is increased, the cell membrane gets also the effect of better blood perfusion, and the hypoxia gets corrected and the cells get better nutrition. So that's how the like vasodilation term is indirectly affecting all the systems. But direct meaning, if you say, then vaso means the dilatation of the vessels. That means the vessels, the arteries and veins.
But also the lymphatic vessels, even the lymphatic fluid is
Uh,
carried through the vessels. Isn't that also part
so
of the vessel then?
this all is
Hmm,
the blood supply only affects the cell membrane, no?
hmm, 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 hmm,
So her question was that
hmm,
only cardiovascular system or other systems. So
hmm,
other systems are affected, but
hmm.
indirectly.
Okay, okay. So that's the scientific view. Very good.
Thank you.
Hmm, hmm.
Mm.
Anyone else? Anything else? Kakuliji? You've been listening very, very attentively, so I know that you are interested. Are you a doctor by any chance also, Dr. Kakuliji? Are you a doctor as well?
No, sir.
No, you're not.
I'm,
Okay. All
I'm not a
right.
doctor. I'm
Okay.
a therapist. Actually, I'm a holistic healer. I'm
Okay.
just actually I'm here because of I'm interested about something new.
Okay. Okay. Excellent. Very
So
good. Mm. Yes, Chandriji, I think you are ready with a question. Go on.
Yeah, actually, I wanted to ask I have got a what do you call ICT positive this time. My
Okay.
indirect COVID test is positive. So, do
Yeah.
you think this technique could help me?
ICT positive means antibody titer is increased, and your the baby who is RH. Are you a RH negative mother?
Yes.
So you must have conceived RH positive fetus. So only by breathing technique this cannot be reversed.
Right.
But to decrease the
No, it
titer,
cannot be reversed, but can it be controlled or could it be beneficial
no,
to some
no,
extent?
no.
No, it has
I
nothing to do
don't
with
think
that.
so. Nothing
Okay,
can be
okay,
done because the
okay.
body is producing antibodies against the RH positive cells, and the fetus is RH positive. So the transfer from placenta to baby's blood, the communication is causing this. So I don't think that breathing can help in this.
Mm,
Okay, okay. Thank you so much.
mm. Okay, very good. Uh, Anyone else? Magdalena ji, any follow-up question for Dr. Jindal or me?
Mm.
No. No? Okay, very good. Yeah. So vasoconstriction, understand these two terms, vasoconstriction, vasodilation, and the Lotus Opening Program. This I gave it the name Lotus Opening Program because of the effect that it has on the systems, not only on the respiratory system, but also on the different chakras. So if you're familiar with yoga and things connected with yoga, we often use the term lotus petals when we speak of the different chakras. So when we think of the Muladhara chakra, we think of a lotus petal with a lotus with four petals. When we think of the Swadhisthana chakra, we think of lotus with six petals, and so on. So when I noticed the effect of some of these techniques and how it felt internally, I said the term lotus opening is a perfect term to describe what is happening.
Yeah.
Now, most of the time, if let's do a small experiment. Watch your breath for a few minutes. As you sit, relaxed, see where your breath is going, how deep your breath is going. It's entering through your nostrils. Try to find the pathway of your breath and see where the breath goes and how long your breath takes, just normally, without any other technique in play. So if you observe, you will feel that your breath is entering through your nostrils. You might feel that it's tending to go upwards and then turn down,
Mm.
and then it goes till the heart or the chest area, or maybe till the belly button area, and so on. Notice this. How deep does your breath go? See, try and notice that. Okay, Dr. Shashi Jindal had to.
Once or twice it is gone till the Muladhara, it's a
Okay.
lower belly.
Okay, so if you feel that it's going till the Muladhara, that's very good because that's something most people cannot experience. Most feel that their breath only goes till the chest area, and sometimes a few people feel it's going till the belly button area, more or less, which is fine. However, it's not enough. Your breath should be able to go all the way down till the Muladhara. Now, as you get into a more relaxed breathing state, for example, if you're doing belly breathing, against not breathing with your belly otherwise, you'll find that your breath is going a little deeper. See, try and see the difference. See if you can catch it. With belly breathing and without belly breathing. If are you familiar with belly breathing? Is everyone aware of what belly breathing is? Does anybody have any questions about it? No? Are you familiar with belly breathing? Are you able to belly breathe? Yeah, you are? Okay. Magdalena is giving me a thumbs up. That's nice. All right. Kakoli, what about you? Are you able to belly breathe? Yeah. Always? Normally? Yeah, because the more you are able to belly breathe, the more you are easily able to access your parasympathetic nervous system. The more easily you are able to access and be in your parasympathetic nervous system, that means the more your body is capable of healing itself. So, belly breathing is a start. When we do lotus opening, in fact, all my breathwork programs, we start with belly breathing because unless a patient or unless a participant or unless anybody with any kind of difficulties is able to switch into the parasympathetic nervous system with belly breathing, any kind of healing becomes difficult. So even in the Shvasko Shuddhi Kriya technique, for example, I start with belly breathing. In the Tridosha balancing program, also we start with belly breathing. In the ED reversal program, again, Women's Ananda program. Women's Ananda program actually is focused on women who face difficulty with sexual arousal, usually after childbirth. This is something that happens to many women after they've had a child. For some reason, their arousal tends to go down. So the Women's Ananda program focuses on that. Swatantra Kriya is the most powerful program that I have to offer. The Swatantra Kriya also works with belly breathing, and of course, you go deeper. Lotus opening is a part of it, and then there are other techniques through which you discover at least three different pathways for your breath. Like just now, Rashmiji said she can feel her breath till the Muladhara, which is excellent. People who learn the Swatantra Kriya, they actually discover three different pathways to take their breath till the Muladhara. And not only that, as you begin to discover these three pathways and you are able to induce lotus opening through all of them, a very deep level of pranamay kosh activation happens. So the whole energy body begins to get activated. Imagine whatever you are doing with just one channel is now done through three channels, actually more than three channels, but three channels are easily accessed. And then the pranamaya kosh begins to become more and more active and available to you. This energizes the whole body, the whole system. So you are able to heal yourself, get into states of wellness very easily, get into deeper meditative states, work on your chakras, cleanse your chakras, activate your chakras, and so on and so forth. All that begins to happen very easily. But that's another part, another program altogether. The main thing is understanding how your breath can impact you in so many marvelous ways. That is the thing. Very often people have not paid attention to their breath, not focused on their breath. They take their breath for granted. They do not understand that breath, the reason we need to breathe so much is because whatever the breath is bringing is so essential for our well-being. So therefore, if breathing happens well, it will impact every area of our lives. And of course, in this program, we've been speaking about how it can affect pregnant women or lactating mother, and then lactating mothers or postpartum mothers, and so on and so forth. So the pre-pregnancy, during the pregnancy, and post-pregnancy period, they are all impacted very powerfully and very beneficially with the Lotus Opening Program and vasodilation. Any questions, anybody so far? Friend?
I have a question
Yes,
about your
Magdalena.
programs.
Yes, Magdalena.
So I would like to do the Swatantra program, yeah, but
Mm.
it so this Lotus opening is part
It's part of the
of
Lotus, yeah,
this
it's part of the Swatantra Kriya, yes.
of Swatantra, and now you will be opening only Lotus opening.
In this particular program, because we are focused on women's challenges when they are pregnant, etc., so we are focused only on helping them open Lotus mainly through one channel. Because if they need to understand all three channels, it's a long program. It may not be the ideal solution for pregnant women. So we work on one particular channel, help them to understand how to do the vasodilation through that system, and then they're able to go through their pregnancy issues better. Yes. Yes, Magdalena.
Thank you.
Mm. Yes, anyone else? Any other questions as far as the Lotus Opening Program and other related breathwork related issues are concerned? If not, we will end because I don't want to take Dr. Shashi Dindal's time unnecessarily. Anybody else? Any question? Rashmi ji, Chandni ji, Kakoli ji, AS, Manish ji. Yes.
No, sir.
No? So then, Shashi ji, thank you very much for your time and your uh, uh, willingness to help explain some of these questions. Oh, she's already left and back. Yeah, Shashi, thank you very much for your time and your answers to all these various questions and explanations about vasodilation and the impact it can have, the beneficial impact it can have on pregnant mothers. Not only pregnant mothers, actually, both pre and post pregnancy as well. So thank you very much. And I think we will end this program for this webinar for now. I'm available. You have my contact information. Please connect with me. I teach various other programs, as you're aware. Magdalena ji, you're welcome to join the Swatantra Kriya. All details are shared. And if you have any questions, please go ahead and send me your questions. I'll be glad to answer you and take you on a very beautiful journey with Swatantra Kriya, where one of the things, see, if you break the word Swatantra, Swa means self. Tantra. Tantra is a technique, it's a system where basically there is use of energy and consciousness. That is what Tantra does. It does it through the participation of men and women, or male and female. And they do it by using sexual arousal. Sexual arousal is seen in a very positive way, not as a negative thing. Sexual arousal is where life begins, or the process of life begins. So therefore it's a good thing, it's not a negative thing. And Tantra uses this energy of sexual arousal to not just get into states where the sexuality is experienced, but that arousal, the energy of that arousal is used to raise consciousness. That is the basic purpose of Tantra. In Swatantra, there is only your breath and your consciousness. So your energy and your consciousness. There is no physical female or male. There is no physical aspect to anything that is done in the Swatantra Kriya program. It's just your breath work and your own chetna. And then through the combination of these two, you actually begin to experience states of ananda, bliss, pleasantness. And you can experience this in various parts of your body, all the way till the brain. And it's very, very, in a way, empowering and freeing, because very often anything to do with sex is like an obsession. People are obsessive about sex. It does so many things to them, to their minds and their emotions and so on. In Swatantra Kriya, just with your own breath, own energy, and consciousness, you experience states of ananda, so that it helps you overcome your obsession and dependence on any external stimulation for that sexual pleasantness. It just becomes part of you. In fact, one of the interesting things that happens in Sanatan Dharma is uh, people who go on the path of spirituality, they often add the term Ananda to their names. Like the great Swami Vivekananda. Vivek, of course, means that wisdom or discrimination or that understanding. Vivekananda, and so on and so forth. Many names, the suffix Ananda is used to show that a person is in a state of bliss. And that is what is experienced in the Swatantra Kriya as well. But that's not where it stops. Swatantra Kriya takes you much, much deeper. It energizes your whole system. And in many ways, it helps you hack directly uh, into your Vijnanamay Kosh. Because normally people are fixated on the Annamay Kosh or the Manomay Kosh, the mind. But with the Swatantra Kriya, the Pranamay Kosh activation, you are able to hack into your Vijnanamay Kosh. When the Vijnanamay Kosh becomes active, then it becomes easy to access information, knowledge, insights, clarity, and so on and so forth. And then, of course, as you continue with your breath work and that energy begins to affect every aspect of your life, a lot of other interesting things happen in life. So that's what the Swatantra Kriya is. And I said that because Magdalena is interested in that and she mentioned that.
Thank you.
You're welcome. Anyone else? Anything else? Shall we wrap up for today? All right. Thank you very much. Thank you, Shashiji, once again for your time and your wisdom and knowledge about pregnancy and so on and so forth. And please do connect with us in the Lotus Opening Program or through my phone numbers, etc. And we'll be happy to work with you in whichever field required. Thank you and namaste.
Namaste.
Thank you, sir. Thank
Thank
you
you.
for
Thank you.
Thank you
nice
so much.
session. Thank you.
Thank you, Shashi.
Thank you very much.
Thank you. Bye-bye.
Bye.